Welcome from Eli Lilly headquarters in the wonderful Circle City of Indianapolis. I am Derwin Smiley, and this is the Derwin Smiley Show. I'm glad you are with me, and the show starts right now. Ms. Monique Hunt-McWilliams is the brand new Chief Diversity Officer here at Eli Lilly and Company. Ms. Hunt-McWilliams, congratulations on your promotion, and tell me a little bit about yourself.
Thank you very much. I'm originally from Indianapolis, and I came up through the IPS public school system.
You said IPS? Okay.
I came up through IPS, all through elementary, middle school, high school, and went to Indiana University in Bloomington, Indiana, with a degree in bachelor's degree in chemistry and a law degree. And I've been practicing law for about 20 years or so. I've come to Lilly in about 1998 as a litigation lawyer. I've been here for 15 years. This is my first assignment outside of the law division, but in an area that I'm very passionate about. I've been working in the area of diversity for quite a long time.
So what can you bring to this position from your law degree background?
Well, I think in many ways, lawyers look at issues from a variety of different perspectives. And I think when we're looking and talking about diversity and inclusion, it's important to have a variety of perspective from which to draw from.
Tell me, what is your definition of diversity and inclusion?
I think we're all familiar with the traditional definition of diversity, which oftentimes is a proxy for gender and race, those sort of demographic examples. And in many ways, diversity still represents those sort of demographic examples, but Lilly is a global company, so we have to think about a much broader definition of diversity. So the demographic and traditional definition looks at the visible differences between people. As a global company, we also look at the invisible differences of people. So, for example, your background, your education, your family culture, what part of the country you're from, what that community itself was like. How do you think? How do you approach issues? How do you solve problems? What's your perspective on things? All of that represents differences that make you a very unique individual. And because of that, diversity is important to everyone. Everyone is diverse in some way. No one is exempt from that definition of diversity. Inclusion is really about how do you make individuals who have differences feel valued and included in the organizations that they associate with. So in a sense, it is how we leverage diversity. So at Lilly, how are we leveraging the differences of all the employees who work here in a way that makes them feel committed and engaged to participate in a way that helps contribute towards Lilly's success?
Can you separate diversity and inclusion?
Absolutely, and unfortunately, that's done a lot. So let's think about it from a historical standpoint. There have been efforts to increase diversity in the workplace and in other institutions for a very long time. But you can have a very diverse environment which is not inclusive. So you could have people of color who would say, well, we have other people of color, but they don't feel included in the process. They don't feel included in the conversation. On the other hand, you can also have a very inclusive environment that lacks diversity in many respects. A team where all the people are very similar and they think exactly alike. There's no one there challenging the concepts or the issues or the conclusions that are discussed at the table. It's probably a very efficient team working together. When you add elements of diversity, it's going to be more complex. It's going to take a little bit more time, but the end result will be better because you have a lot of different perspectives participating in the process. So it's best to have both, because when you have diversity and you have inclusion, that can lead to great creative ideas and innovation. And that is Eli Lilly's strategy. We have an innovation strategy. And so it's very important to us that we have a diverse environment, because that's going to foster creativity and ideas, and those creativity and ideas are going to drive innovation, and that's going to get us to Eli Lilly's success as a company.
I want you to talk about the buy-in of the upper echelon of management when it comes into diversity and inclusion.
We have support at the highest level of the company. Our CEO, John Lechleiter, is committed to diversity. In fact, he has been very emphatic that if there's a leader at Eli Lilly and Company who doesn't want to be an inclusive leader, who doesn't want to value the differences of all of our people and do everything they can to make sure that they're fully engaged, this might not be the place for them to work. His direct reports are also very engaged in conversations around diversity, and many of them participate as executive sponsors of employee resource groups, or ERGs as we call them, who participate in a lot of different activities and events for different diverse communities within our population. So for example, we have an African American network, which is a community of our African American employees. They have different events, and they have an executive sponsor. In fact, their executive sponsor is Bart Peterson. We have 10 ERGs altogether, and all of them have an executive sponsor who is a direct report of our CEO. So our leaders are very integral in making sure that we have a diverse and inclusive environment.
She is Miss Monique Hunt-McWilliams. We have to take a break. Stay with us. Thank you for staying with us. We will continue our conversation with Ms. Monique Hunt-McWilliams, the new Chief Diversity Officer here at Eli Lilly and Company. Ms. Monique, I wanted to piggyback and go a little bit further into why diversity and inclusion is important on a global scale.
On a global scale, we treat patients with our medications around the world. We have employees, 38,000 of them, that work for us on a worldwide basis. The world is becoming more and more diverse. We can take the U.S. as even a proxy for that, and we're looking at how minority groups are growing by leaps and bounds in the United States alone. It is important to Lilly that we have an employee base that in some ways look like the population of patients who will take our medications. Because if we have employees who understand those cultures of diverse people, whether they are patients, whether they are the physicians who will prescribe our medications, whether they are other suppliers and partners with whom we have to work in order to get our medications distributed, that is very important. We need to make sure that we have employees who understand the needs of this diverse population of people and who can help meet their needs and can communicate with them on a level that they will appreciate. As we think about that internally with respect to Lilly, it also means we have to have an inclusive work environment. And that is most important for us to have inclusive leadership. Leaders who value the importance of an inclusive environment so that they understand they have to make connections with all their employees. They have to understand how and why they are diverse and different, respect and value those differences in a way that truly engages all of those employees so they can contribute to the success of the company.
I want you know, with the economy how it is now, a lot of budgets are being cut. So how, from your perspective, how important is diversity and inclusion as it pertains to affecting the bottom line?
Well, I've had some conversations with our CEO about that, and it's no secret that the pharmaceutical industry is in fact going through a very difficult time, and that Eli Lilly and Company is also looking at some patent expirations of some of our most successful products. But he's made it very clear that diversity and inclusion is not an option. it's something we have to continue to strive for, have to continue to work on and make sure we implement through the very fabric, the very DNA of our company. And so we're not pulling back. We're not putting on the brakes at all when it comes to diversity and inclusion. From an innovation standpoint, we can take demographic diversity, which is gender, race, and a few others, as sort of a proxy, if you will, sort of a signal, a lead indicator for how well we are doing as a company. Are we fishing from the biggest pond in a sense of, are we bringing in the best talent possible? Are we looking at the broadest pool of potential employees for promotions? Are we making sure that we have some of the most diverse candidates to consider for every promotion? So we're looking very consciously at how diversity and inclusion is important throughout the entire organization that we have on a worldwide basis to make sure that we continue to meet the needs of the diverse population of patients that we seek to serve.
With a couple of minutes left in the conversation, can you tell me your vision as it pertains to your Office of Diversity and Inclusion?
We have a global mission as a Global Office of Diversity and Inclusion. And the vision that we have right now is that the company would continue on the path that we've started towards a more inclusive work environment that values the diversity of talent that we have here on a global basis. And that is somewhat of a culture change, and we're very committed to it. We're working hard to get it achieved, and our office is working very closely with not only executives in the company, but all of our employees. We are working to galvanize around this vision and make sure that we bring it to fruition.
Talk a little bit, I got 30 seconds. Talk a little bit about your staff.
Well, it's a tremendous staff. We have Charlotte Hawthorne, who has been working in the diversity inclusion space for quite a while, and she has some very important certifications that make her what I consider to be one of the persons most knowledgeable or a thought leader in this particular area. We have Janice Chavers, and she is a corporate communications professional. So she's responsible for all the corporate communications related to diversity. And we have Karen Whiteside, who is very engaged with our employee resource groups, making sure that each of those 10 groups that represent the diverse communities within Lilly are contributing to the business strategy of the company, but also supporting the unique needs of those diverse communities.
She is Ms. Monique Hunt-McWilliams, the new Chief Diversity Officer here at Eli Lilly and Company. Ms. Hunt-McWilliams, it's an honor to have you on the show. Come back anytime.
Thank you.
Dr. Coleman Obasaju is the Senior Director of Global Diversity and Clinical Research. Dr. Obasaju, it's an honor to have you.
Thanks for having me. I deeply appreciate it.
Yes, sir. Could you tell me about yourself and what your position is at Eli Lilly and Company?
Thanks a lot for that question. For many of you, I don't know whether you can detect a Nigerian, British, American accent. That summarizes, some of my journey in life. In 1982, I graduated from the medical school in Nigeria, University College Hospital, Ibadan. And it was that year, precisely about 31 years ago, that it dawned on me that I had a passion to pursue a career in oncology. And actually this was prompted by the fact that I saw so many cancer patients with far advanced disease with very little or nothing available to provide relief, not even to talk about cure. I was heartbroken. It was too painful for me to watch. And I made a conscious decision that I wanted to be part of a group of people who will be exploring the possibility of new, better treatments for cancer patients. As soon as I landed on that decision, it became clear to me that I was not going to stay in Nigeria for much longer, because Nigeria then did not have the training program that will help one to develop the skills of drug development in the oncology area. In 1987, I was fortunate to have the opportunity to go to Manchester, England, so the English aspect of my accent. And I was at the Christie Hospital and the University of Manchester doing postgraduate studies, in the area of pharmacology, drug development, as well as also gaining some expertise in terms of taking care of the cancer patients. In 1993, I was fortunate to get an award, by the American Cancer Society called an Audrey Mayermas Fellowship. That took me to First Chase, Cancer Center in Philadelphia. And whilst at First Chase, I, decided to train in the American system. So I did internal medicine, residency program, board certification, and did a hematology oncology fellowship at the First Chase Cancer Center and Temple University. And after that, I stayed a little bit because the institution wanted me to still stay on in the area of academic research, clinical responsibility. But in 2001, I made the landmark decision to join Eli Lilly and Company, and this is driven again by my passion for drug development. I felt that Eli Lilly and Company was a fit for me. I was able to join the oncology therapeutic area in 2001, and I have not regretted it ever since. It's given me the opportunity to work collaboratively with great scientific minds within the company and outside of the company. So that, in a nutshell, is my journey through life.
It's a whole lot, but
yeah.
I can see just your passion for just sitting here with you that you have for that. I wanted to focus this interview, this conversation about clinical trials. How important is clinical trials coming from minority groups?
I'm very, very glad that you posed this extremely important question. In general, clinical trials is very, very important. Right now, we still have more than 2,000 areas of unmet need in the disease category. So in other words, you still have more than 2,000 diseases for which we do not have a cure today. And the avenue through which we can cite promising drugs to help people to live better, longer lives is through the avenue of clinical trials. There's no other avenue through which, or process through which, breakthrough treatments can be developed. So clinical trials is very, very important because of huge unmet need. Now, specifically to the participation of minorities, what was very shocking to me after I joined the company in 2001 was the gross underrepresentation of the minority population in clinical trials. In fact, in the oncology therapeutic area, the statistics is even worse. So, for example, when you look at many of the large trials, you will be fortunate to have 1 to 3% representation of African Americans in those studies. Same thing with the Hispanic population. Obviously, that poses a big problem because not having adequate representation of those minority groups in those clinical trials makes it very, very difficult and challenging for one to generalize the outcome of those trials to those minority population. So obviously, it is in the best interest of the minority group to participate in the breakthrough treatment outcomes, to be part and parcel of people who are engaged in the clinical trial process, because that will help us to better characterize what is the efficacy or how good those drugs are and the side effect profile of those drugs in the minority population. So to me, it is very, very critical. We cannot be spectators. We have to engage in the clinical trial process so that we can have the confidence and the assurance that these drugs that are being approved, they truly are delivering what they are promising to deliver also in the minority population.
Doctor, we have to take a break. Stay with us.
Before I got here, I didn't come with any type of expectation. Whatever I saw, I was going to see how I could make a difference. But being here, I realized that the difference is much bigger than I am. So what I try to do is I'm trying to make a small impact within a short amount of time. Well, I feel like we've been able to do that.
Thank you for staying with us. We will continue our conversation with Dr. Coleman Obasaju. Doctor, as we went to break, you was talking about clinical trials and the importance of having a population of minority specimens. Can you tell me how can you get the fear, get the African community to overcome the fear of the Tuskegee experiment? Everybody know about the Tuskegee experiment with the government putting syphilis into African American males, and how can you get the African American community past the fear that clinical trials are very safe?
Thank you so much for this very important question. And I have to say, this is a situation whereby it definitely takes a village to raise a child. And this is something that one company cannot just do alone. It's going to call for a lot of collaboration, advocacy groups, associations that are very, very passionate about the engagement of the minority population in clinical trials. And a lot is already being done in this area. So, for example, since the Tuskegee experience, you now have institutional review boards, or what we call IRBs, that meticulously looks over protocols, clinical trial protocols, to make sure that this kind of event will not repeat itself. There is a lot more transparency that has been brought into the system. We have the informed consent document whereby, as much as possible, the person who is being engaged in the clinical trial process, they know what is their right, and they understand what they are getting into. There is a lot of transparency in terms of publishing what trials are ongoing, when those trials finish, and also the outcome. So, for example, there's clinicaltrial.gov that is searchable now to the general public. So a lot of guardrails has been put in place to try to prevent a reoccurrence of these very, very sad, painful incidents. I want to leverage the Smiley show to talk to hundreds of you or thousands of you who may be calling in. We have to let the fear of the past, be gone. Right now, the system is a lot safer. And let us climb over this wall of fear to be engaged in the clinical trial process, because we need to be engaged.
So can you take me through the process? If I'm a person says, I want to participate in a clinical trial, take me through the process that person that I would go through with the clinical trial.
Yeah, so basically, the person who will offer the possibility of a clinical trial is going to be the treating physician. So that is part and parcel of the conversation that takes place between a treating physician and a patient. And typically, when a disease is diagnosed, the treating physician is going to discuss a menu of options with the patient. If there is a standard of care, something that is already vetted, that works, that is available, many a times the treating physician will say to the patient, this is the standard of care. Okay. But in many instances, like I said, you have over 2,000 unmet needs. There may not be a cure. There may not be a standard of care. What is available may not be good enough. So that provides the opportunity for the physician to then engage the patient about participation in clinical trials. It is expected that the physician is going to provide adequate information. If there's a translator that is needed so that the patient can understand, what he or she is getting into, a translator will be used. So for example, there are some Hispanic people who may not understand English, and there has been a lot of effort to make sure that, even the English is to the level that many patients can understand, maybe like, grade level 8, level, so that the patient does understand what they are getting into. So if the patient then, reads the informed consent, document, and he or she feels that they will want to engage in the clinical trial process, they will then sign up for the clinical trial, and then the process continues. I know that is kind of very simplistic way of explaining it, but yeah, it is one of the conversations that take place between the treating physician and the patient. And there may be some situation whereby a particular clinical trial may not be available in that office, but the treating physician will say, okay, I can refer you to that academic center. They have a clinical trial ongoing so that you can participate in the clinical trial. And some patients are happy, to go to another institution to engage in the clinical trial process.
He is Dr. Coleman Obasaju. Doctor, it's an honor to have you.
Honor to have you. Thank you for having me.
Yes, sir. That's our show for this evening. And remember, you can follow the Derwin Smiley Show on the World Wide Web at thederwinsmileyshow.com. And remember, my sole purpose is to inspire greatness in you. I'll see you next time.